Hi guys, welcome to the bouldering presentation. Bouldering is a type of rock climbing that is on small rock formations, whether inside or outside, usually without ropes. There's also a type of climbing called top roping. That includes using ropes and harnesses to catch your falls if you were falling from higher rocks. Okay, some things to consider. Equipment. First off, you got shoes. They're rubbery, they help you stick to the wall, get up some stuff. Next, we got chalk bags. Sometimes your hands get sweaty. Put some chalk on there. Now your hands are dry. You can climb anything. Last, we got harnesses. You put this bad boy on, you're climbing up some ropes. If you fall, you're sitting in this cozy thing all day. So the last piece of equipment you need are some ropes. Sometimes you're going on longer climbs, you're going really high up. If you fall, you're gonna get hurt, and that really sucks. So you get a rope, you climb up a little bit. If you fall, you're only falling a little bit. So much better.
Hello everyone, Fernando here. Now that we have learned a little bit about bouldering, we're going to analyze some of the common movements seen in it. We're going to break down 3 different movements and focus on multiple joints, as bouldering is an activity that requires the coordination of multiple limbs all working in conjunction with each other in order to progress up a wall. In this first phase, we will analyze my movements using the muscle control formula, going from A to B. At the hip, we see a concentric contraction that causes hip extension. The external force is the downward resistance from gravity, causing hip flexion. This occurs in the sagittal plane. The muscles that control this movement are the biceps femoris, gluteus maximus, semimembranosus, and semitendinosus. At the knee, we see a concentric contraction that causes knee extension. The gravity is still the external force causing knee flexion. This occurs in the sagittal plane. The muscles that control this movement are the rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. At the ankle, there is a concentric contraction that causes ankle plantar flexion. The external force causes ankle dorsiflexion. This occurs in the sagittal plane. The muscles that control this movement are the gastrocnemius and soleus. At the elbow, we have a concentric contraction that causes elbow flexion. The external force causes elbow extension. This occurs in the sagittal plane. The muscles that control this movement are the biceps brachii, brachialis, and brachioradialis. And now, I will be handing it off to Janelle to focus on the next joints.
Hi everyone, this is Janelle, and I will be finishing up Phase 1 and beginning part of Phase 2. At the forearm, the movement is forearm pronation and the external force is forearm supination, making this a concentric contraction. This takes place on the transverse plane, and the muscles controlling the movement are the pronator teres, pronator quadratus, and the brachioradialis. At the shoulder, the movement is shoulder flexion and the external force is shoulder extension, making this a concentric contraction. This takes place on the sagittal plane, and the muscles controlling the movement are the anterior deltoid and the pectoralis major. For Phase 2, we will be analyzing Nelson's movement of the upper body by using the muscle control formula by going from A to B. At the right shoulder, the movement is shoulder flexion, and the external force is shoulder extension, making this a concentric contraction. This takes place on the sagittal plane, and the muscles controlling the movement are the anterior deltoid and the pectoralis major. At the left shoulder, the movements are shoulder extension and shoulder horizontal abduction, and the external forces are shoulder flexion and shoulder horizontal adduction, making this a concentric contraction. This is a multiplanar motion, and the muscles controlling the movement are the posterior deltoid, latissimus dorsi, teres major, and teres minor. And now I'll be handing it off to Nelson to finish Phase 2. Thank you.
Hello classmates and professor. For the next 3 slides, I will be going over the movements of the elbow, the MCPs, and the wrists. Due to the acute angle of the wall and the gravitational forces acted against the hanging position from point A to point B, movement on the elbow joint is considered elbow flexion. The external force is elbow extension. The muscle action is concentric contraction in a sagittal plane of motion, and the muscles providing the movement at the elbow joint are the biceps brachii, the brachialis, and the brachioradialis. At the metacarpophalangeal joints, we have a movement that allows for actual gripping at the handles. This is done through flexion at the MCP joints. Given that the subject is hanging off of the wall on an angle, the external force of the MCP joints is extension, and muscle actions are concentric contractions of the flexor pollicis longus, flexor pollicis brevis, flexor digiti minimi brevis, flexor digitorum superficialis, and the flexor digitorum profundus. And finally, we have the wrist joint. From position A to position B, the movement at the wrist joint is wrist extension. Again, because of the hanging position and the resistance it creates from a downward hanging force, the external force is wrist flexion. The muscle action is a concentric contraction taking place in a sagittal plane of motion. Muscles involved in this movement at the wrist are the flexor pollicis longus, flexor pollicis brevis, flexor digiti minimi brevis, the flexor digitorum superficialis, and the flexor digitorum profundus. With this being said, thank you all for listening. I will now pass this presentation over to Lauren, who will go over phase 3.
We will now be discussing phase 3 as it pertains to the lower body. We will be doing so by using the muscle control formula as Joey moves from position A to B. Starting off with the hip, the movement is hip adduction with an external force of hip abduction. The muscle action is concentric contraction, and this is occurring in the frontal plane. The muscles providing and controlling the movement include the adductor magnus, adductor brevis, adductor longus, as well as the gracilis muscles. Moving on to the knee, the movement occurring is knee flexion, the external force is knee extension, and the muscle action is concentric contraction. This is occurring on the sagittal plane, and the muscles providing and controlling this movement include the biceps femoris, semitendinosus, as well as the semimembranosus. Last but certainly not least, in phase 3, we have the ankle joint. The movement occurring is ankle plantar flexion, the external force is ankle dorsiflexion, and the muscle action is concentric contraction. The plane of motion is the sagittal plane, and the muscles providing and controlling the movement include both the gastrocnemius as well as the soleus. I will now be passing things along to Joey as he discusses both the biomechanics and injuries associated with these phases.
There are a few biomechanical factors to consider when climbing, one of which is the degree of angle on the wall. If the wall is slanted inwards, it becomes a lot more difficult, but if it's slanted outwards, it becomes a lot easier. Gravity is also something to consider. At all times, gravity is acting upon the climber, pulling them off the climb. Finally, friction is a big key in climbing. The amount of friction on a hold or on a foothold can make all the difference on whether a climb is easy or difficult. There's a lot of inherent risk that comes with climbing. The most common injury are broken and sprained ankles. Typically, people fall and land incorrectly, rolling their ankle or twisting it in the wrong direction. When falling, broken bones also occur, as people stick out their arm, putting a lot of strain on their wrists, elbows, and shoulders. Finger injuries are also common, as people try and crimp and pull on small holds. It puts a lot of wear and tear on those fingers. A lot of synovial fluid tends to build up in fingers, leading to arthritis later in life and other types of injuries. Skin tears are also common, as people use chalk to dry out their hands to stay on a climb. It leads to the drying out of the skin, which causes it to tear and rip off. Eventually, calluses begin to build up, and these tend to go away. Tennis elbow is also common in climbing. It's a painful condition also known as lateral epicondylitis. The overload on the elbow joint due to the repetitive motions causes many injuries in climbing.